Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been through quite a lot with the colectomy and chemotherapy back in June. It was really tough, almost didn't make it. Since then, I've been worried about the cancer coming back. We've got that colonoscopy coming up to keep an eye on things.
I understand your concerns, especially after such intensive treatments. How have you been feeling overall since your chemotherapy?
Well, physically, I'm feeling much better now. My appetite is back, and my weight has returned to what it was before the chemo. I've started biking again to build my strength back up. But my stools have changed, softer than usual, though no blood or anything alarming.
Good to hear about your recovery progress. The change in stool consistency might just be a part of your system adjusting post-surgery and treatment. It's good that there's no blood. How about other symptoms? Any fever or respiratory issues?
No fever or chills, thankfully. I do have this persistent cough, though, probably from smoking, which I'm trying hard to cut back on.
That's a good step, reducing smoking. It's crucial for your overall health, especially after what you've been through. Now, regarding your medications, it's important to discuss your compliance. You mentioned you haven't been taking your medications regularly?
Yes, that's right. I've been quite lax with the blood pressure meds and the cholesterol pills. I do take the eye drops for my glaucoma without fail, but the others, not so much.
It's vital to stick to your prescribed medications to manage your health effectively, especially your blood pressure and cholesterol. It will also benefit your long-term recovery and general health. Let's make sure you have a system in place to help with that.
I know. I need to be better about it. I've started using a pill holder now to keep track.
That's a good strategy. How about your recent checkups? Any issues there?
I have a cholesterol check scheduled soon, and I'm also seeing a podiatrist, plus the regular flushes for my portacath.
Keeping up with those appointments is great. It looks like you're getting back into the routine of managing your health.
Trying to, at least. My wife has been a huge help, making sure I eat well and all.
Support at home makes a big difference. Now, let's review some of your recent lab results and see how things are going internally. Your blood pressure today is a bit elevated at 142/88, and it's important we keep an eye on that given your history. Your heart rate and respiratory rates are stable, which is good. Your body mass index is also within a healthy range.
That sounds promising. What about the blood tests?
Your complete blood count looks good. Hemoglobin, white blood cells, and platelets are all within normal ranges. Kidney function with BUN and creatinine is stable, and your liver enzymes AST and AL are also normal. Your fasting glucose is well controlled. Importantly, your CEA levels, which help us monitor for potential cancer recurrence, are within normal limits.
That's relieving to hear, especially about the cancer markers.
Yes, it's very encouraging. Your ECG shows normal sinus rhythm with no significant issues, and your imaging studies, including the chest X-ray and abdominal ultrasound, didn't show any abnormalities. Overall, your clinical assessments are showing positive outcomes.
That's good. What's the next step then?
Continuing with your current recovery and health maintenance plan is key. This includes taking your medications regularly, continuing physical activity, and eating well. We'll go ahead with the scheduled colonoscopy to monitor for any changes in the colon and keep a close watch on your heart with the upcoming cardiology appointment.
Sounds like a plan. I appreciate your help and guidance through all this.
Of course, it's important to keep this momentum going and manage your health proactively. If you have any concerns or new symptoms, don't hesitate to contact us. We're here to support you every step of the way.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I've been really struggling lately. My anxiety is off the charts with the colonoscopy coming up. I keep thinking about my brother and his diagnosis, and it just sends my mind racing. I know I've been drinking more than I should. It's the only thing that seems to help with the nerves.
I understand how stressful this must be for you, especially considering your family history. It's important that we address both your anxiety and your physical symptoms comprehensively. Let's talk more about your symptoms. How has your sleep been affected?
My sleep is terrible, honestly. Even with the medications, I'm either tossing and turning, or I wake up in the middle of the night and can't go back to sleep. The restlessness doesn't help either. My legs just won't stay still.
And the pain in your thigh, how would you describe it? Has there been any change in the intensity or frequency?
The pain is sharp, and sometimes it feels like electric shocks going through my leg. It's been getting worse. Just last week, I had to stop halfway while walking to the store because the pain hit me so suddenly. I've noticed it's triggered by certain movements, or even when I'm just trying to relax.
It sounds very challenging. You mentioned using albuterol for breathing difficulties. Can you tell me more about those episodes?
They're sporadic, maybe once or twice a month. I feel this sudden tightness in my chest and start wheezing. The inhaler helps, but I never really thought it was asthma since it happens so rarely.
I see. And with your recent episodes of chest pain, were there any activities or events that seemed to trigger them?
They mostly come on suddenly. I notice they happen more often when I'm stressed or if I've had a few drinks. I'm really worried there's something more serious going on, given my symptoms and my family's health history.
That's a valid concern, and we're taking all the right steps to understand what's happening. Have you been able to follow your prescribed medication regimen consistently?
I try to, but some days I'm just not on top of it, especially with everything going on. I know I should be better about it.
It's okay. It's important to acknowledge these challenges. We're here to help you through this. Have you found anything that helps with your anxiety or pain that doesn't involve drinking?
Not really. Nothing seems to help the way a drink does. I used to run, and that helped a bit with stress, but with the leg pain, I just haven't been able to keep it up.
Let's see how we can support you better. For now, I'll go over the results from your recent tests and then we can discuss the next steps. Your blood pressure today is a bit elevated at 104 to 85 mmHg, which is likely due to your current stress levels. Your pulse is normal at 78 beats per minute and your respiratory rate is also normal. The blood tests, including your CBC, are within normal limits, which is good. Your liver and kidney functions are also stable, but we'll keep an eye on them, especially considering your increase in alcohol consumption. We have to find an alternative going forward.
I appreciate that. I'm just worried about all of this coming together. The pain, the anxiety, the upcoming tests.
Of course, it's a lot to manage. Here's what we'll do. I want to focus on optimizing your medication to better control your anxiety and pain. We also need to revisit your sleep medication to see if adjustments are needed there to help you sleep better. Regarding your anxiety, I'll refer you to our counselor to develop some coping strategies specifically for medical procedures. And finally, we'll schedule a follow-up after your colonoscopy to discuss the results and next steps.
That sounds like a plan. Thank you for helping me through this. It means a lot to have support.
You're welcome. It's important to us that you feel supported and informed every step of the way. We'll work together to get through this.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I respect your decision to refuse the proposed treatment, but as your physician, it's crucial we discuss the implications. Why do you feel this treatment isn't right for you?
I've read about the side effects, and I'm really scared they will disrupt my life even more than my current condition. I'm not sure the potential benefits outweigh these risks.
That's a valid concern, and I'm here to help you weigh those risks against the potential benefits. Refusing this treatment could lead to worsening symptoms or other complications. Have you considered alternative therapies that might be less invasive?
I'm open to alternatives, but haven't found much information. Could you provide some guidance on those?
Certainly. There are other treatments we can consider that might have milder side effects. I'll provide you with detailed information on each, and we can discuss further. It's important for you to feel comfortable and informed about your choices.
Thank you, Doctor. I appreciate your understanding and the information. I want to avoid rushing into a decision without considering all my options carefully.
Absolutely. Making an informed decision is crucial, and I'm here to support you through this process. Let's schedule another appointment to go over the alternatives in detail. Your health and peace of mind are our top priorities.
Now look at question 26.
Being aware of the initial symptoms is key to managing asthma effectively. Early signs include increased shortness of breath, wheezing, or a persistent cough, especially at night. You may also notice a feeling of tightness in your chest or increased fatigue during physical activity, which are indicators that your asthma may be worsening. Another important sign is the need to use your quick relief inhaler more often. If you find yourself reaching for your inhaler more frequently, this is a clear sign that your asthma is not well controlled. Additionally, monitoring peak flow rates can help detect decreases in lung function before it becomes critical. It's important to act quickly if you notice any of these signs. Adjusting your medication, consulting with your healthcare provider, and avoiding triggers are essential steps.
Now look at question 27.
I understand how hard these conversations can be, and I appreciate you taking the time to discuss your loved one's care. Given the progression of their illness, we need to consider palliative care.
It's really tough to hear that. What exactly does palliative care involve? Will he still receive treatments for his condition?
Palliative care is designed to provide relief from the symptoms and stress of a serious illness. The goal is to improve quality of life for both the patient and the family. Your father would still receive medical treatment for his symptoms, but the focus would shift to managing pain and discomfort rather than trying to cure the illness.
Would he be able to stay at home, or would he need to be in a hospital?
Palliative care can be provided in various settings, including at home, in a hospital, or at a palliative care facility. We can work together to decide the best environment for him based on his needs and your family's preferences.
Thank you for explaining that. It's a lot to consider, but it sounds like it might be the best way to ensure his comfort.
Absolutely, and we are here to support you and your family through every step. Let's set up a time to meet with our palliative care team to discuss everything in detail.
Now look at question 28.
Welcome everyone. Today we're going to discuss how to develop a mental health crisis intervention plan, an essential tool for anyone facing mental health challenges or supporting someone who is. A well-prepared plan helps to act swiftly and effectively during a crisis, potentially saving lives. First, let's discuss identifying the warning signs. These can vary widely, but often include sudden changes in behavior, expressing feelings of hopelessness, or withdrawing from social interactions. Recognizing these signs early can be crucial. Once signs are identified, the next step is immediate action. This could mean contacting a mental health professional, reaching out to a crisis hotline, or initiating safety protocols if there's a risk of harm. Everyone's crisis plan will look a bit different, tailored to their specific needs. It should also include a list of contacts, family, friends, therapists who can be reached during an emergency. Lastly, let's talk about maintaining the plan. keeping it updated and rehearsed. Does anyone have questions or examples they'd like to discuss on how to tailor a crisis plan?
Now look at question 29.
Hello, I'm here to help manage your medications during your hospital stay. Let's start by listing all the medications you currently take. This includes prescriptions, over-the-counter drugs, and any supplements.
All right, I take a statin every evening for my cholesterol, and I have a prescription for blood pressure twice a day.
Thank you. Do you take any over-the-counter medications regularly?
I occasionally take aspirin for headaches and melatonin to help with sleep. Should I mention the vitamins I take as well?
Yes, please include everything, even vitamins and herbal supplements. It's important to ensure there are no interactions with the medications we might need to administer during your stay.
I take a multivitamin, vitamin D, and a fish oil capsule daily. I also started taking CBD oil recently. Is that relevant?
Absolutely. Everything you take can have potential interactions. Thanks for being thorough. Let's make sure we have the correct dosages for each, and then we'll discuss how we can manage these during your stay.
Now look at question 30.
Welcome to today's training session on the Hospital Incident Command System, or HICS. This framework is vital for organizing and managing response efforts during incidents of all sizes within a hospital setting. The HICS structure is designed to help us assign responsibilities clearly, manage resources efficiently, and respond to incidents effectively. Key positions include the incident commander, who has overall responsibility for the incident, and section chiefs for operations, planning, logistics, and finance administration. Each role has specific functions. For example, operations manages tactical operations aimed at reducing the immediate hazard. Planning is responsible for collecting, evaluating, and disseminating information about the incident. Logistics provides resources and services to support the incident, and finance administration manages financial aspects and record keeping. We will go through each role in detail, discuss their responsibilities, and then participate in a simulation exercise to see how these roles interact during an incident. Are there any questions before we begin, or specific scenarios you would like to discuss in our simulation?
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Today, we're diving deep into the complexities of managing type 2 diabetes, a prevalent chronic condition that affects millions worldwide. We'll explore the nuanced relationship between diabetes management and the development of diabetic neuropathy, a common but often debilitating complication. We're also going to look at a particular case study that highlights the challenges and strategies for managing this condition effectively. Type 2 diabetes is characterized by insulin resistance and relative insulin deficiency. Over time, poorly managed diabetes can lead to a range of complications, including cardiovascular diseases, renal impairment, and diabetic neuropathy. Diabetic neuropathy, in particular, presents a significant challenge due to its impact on mobility, leading to decreased quality of life and its contribution to morbidity in diabetic patients. Neuropathy in diabetic patients manifests primarily as peripheral neuropathy, where patients experience loss of sensation, pain, and sometimes injuries that they cannot feel, leading to infections and complications. The pathophysiology involves glucose-induced damage to the nerve fibers, particularly the small blood vessels that supply these nerves, leading to ischemia and nerve cell death. Now, let's discuss a case that illustrates these challenges. Consider the situation of Mr. Smith, a 60-year-old male with a 15-year history of type 2 diabetes. He initially managed his diabetes with oral hypoglycemics, but had poorly controlled blood glucose levels. Over the years, Mr. Smith has developed peripheral neuropathy, which he first noticed as numbness in his toes and feet, progressing to painful tingling sensations that disrupt his sleep and mobility. In managing a patient like Mr. Smith, it's crucial to approach his care holistically. First and foremost, tight glycemic control is paramount. Studies such as those published in the New England Journal of Medicine have consistently shown that maintaining blood glucose levels within a target range can significantly slow the progression of neuropathy. Mr. Smith's management would therefore include adjusting his medication regimen, possibly incorporating insulin therapy to achieve better glycemic control. Next, pain management is crucial for improving quality of life. Antidepressants like duloxetine and anticonvulsants such as pregabalin are often used to manage neuropathic pain and have been endorsed by guidelines from the American Diabetes Association. For Mr. Smith, starting on a low dose of pregabalin and titrating up based on his pain relief response and side effects could be a viable strategy. Furthermore, patient education and regular monitoring play critical roles. Mr. Smith should be educated on the importance of foot care to prevent injuries and infections, which he may not notice due to reduced sensation. Regular podiatry visits should be arranged, and Mr. Smith should be taught how to inspect his feet daily for any signs of injury. Additionally, lifestyle modifications can have a substantial impact. Dietary adjustments to manage blood glucose levels, combined with regular physical activity, can improve insulin sensitivity and contribute to overall nerve health. Mr. Smith should be encouraged to work with a dietitian and a physiotherapist to incorporate these changes in a way that is sustainable and effective. Managing diabetic neuropathy involves a multifaceted approach that includes optimizing glycemic control, managing pain, educating the patient, and encouraging lifestyle modifications. Each patient's management plan must be tailored to their specific needs and circumstances, as demonstrated in Mr. Smith's case. By following these principles, we can help patients like Mr. Smith not only manage their symptoms, but also significantly improve their quality of life.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, and welcome to today's healthcare discussion, where we delve into the intricate relationship between HIV management and cardiovascular health. Recent advances in HIV treatment have significantly improved life expectancy for individuals living with HIV. However, this success brings new challenges, particularly in managing long-term comorbidities, such as cardiovascular diseases, CVD. Cardiovascular diseases are now a leading cause of morbidity and mortality in HIV-positive populations, which is thought to be due to a combination of HIV infection, antiretroviral therapy, ART, and traditional cardiovascular risk factors. Today, we'll explore this complex interplay and discuss strategies for cardiovascular risk management in patients with HIV. The case of John, a 54-year-old male with a 20-year history of HIV, underscores the challenges at the intersection of HIV management and cardiovascular care. John was diagnosed with HIV in his 30s. Thanks to effective ART, his HIV has been well controlled with an undetectable viral load and a stable CD4 count of 650 cells per millimolar. However, during a routine checkup, it was discovered that John has developed hypertension and early signs of coronary artery disease. Let's start by understanding why individuals like John are at an increased risk. Research indicates that HIV-infected individuals are at a higher risk of developing CVD. This risk is multifactorial. Firstly, the virus itself contributes to this increased risk. HIV promotes inflammation and affects the endothelial function of blood vessels, which can accelerate atherosclerosis. Secondly, certain ARTs are known to affect lipid metabolism, leading to increased levels of cholesterol and triglycerides, which are risk factors for CVD. Furthermore, traditional risk factors such as smoking, which is more prevalent in the HIV-positive population, and lifestyle factors compound this risk. In John's case, his sedentary lifestyle and smoking history have likely contributed to his cardiovascular issues. Management strategies for patients like John involve a comprehensive approach. Cardiovascular risk assessment in patients with HIV should be an integral part of routine care. This involves regular monitoring of blood pressure, lipid profiles, and glucose levels, alongside HIV parameters like viral load and CD4 count. In treating HIV patients with elevated cardiovascular risk, the choice of ART can be crucial. Some antiretroviral drugs have been associated with an increased risk of cardiovascular events. Therefore, in patients like John, it might be beneficial to switch to ART regimens with a more favorable cardiovascular risk profile. Recent studies suggest that integrase inhibitors, for example, have a lower impact on lipid levels compared to some other classes of ART. Lifestyle modifications are equally crucial. This includes dietary advice to adopt a heart-healthy diet, rich in fruits, vegetables, whole grains, and lean proteins, and low in saturated fats and sugars. Regular physical activity is also recommended, with guidelines suggesting at least 150 minutes of moderate aerobic exercise per week. Smoking cessation is imperative, and John has been referred to a smoking cessation program. Medication for managing CVD risk factors, such as statins for high cholesterol and antihypertensive drugs for high blood pressure, should be used judiciously, considering potential interactions with ART. Collaboration between HIV specialists and cardiologists is essential to optimize care for these patients. Managing cardiovascular risk in HIV-infected individuals requires a tailored approach that considers the unique aspects of both HIV and cardiovascular disease management. It's about adjusting ART regimens, aggressively managing traditional cardiovascular risk factors, and ensuring close monitoring and coordination of care. This comprehensive management strategy not only improves the quality of life for patients like John, but also reduces the long-term cardiovascular complications, ensuring that the successes achieved in the treatment of HIV are not overshadowed by new health challenges.